So this is what you guys were waiting for, some gross pictures of pressure ulcers. So I want to show you a few things. This one right here looks like at least a stage 3, possibly a stage 4, but you can definitely start seeing that fatty tissue. And the thing that I want you to notice here are these areas here and here. So what's probably happening with this pressure ulcer is that there's tunneling underneath the skin, under the epidermis. So these wounds most likely are connected to each other. This one probably connects to this one. These probably connect to each other. Okay, so this would be from laying on your back for too long. These right here are probably from sitting in one position for too long and not moving. So like I said, this can happen pretty quickly. You'd be surprised. This can happen certainly. That damage can happen in a day, and then you're going to start seeing the tissue breaking down after that damage has occurred. This right here is a stage 4. You can see, I'm not sure if that's a bone or a tendon, but it looks like it healed up pretty nicely. Thing about a pressure ulcer, after it heals, it never really goes back to being, you can't stage backwards, so this could never go to being like a stage 2 because that area is now damaged and it's at high risk for breaking open again. So I'm always going to have to be watching this area even after it heals so that this doesn't happen again to this person. These wounds take a long time to heal. I'm talking months, maybe even years for some people for that tissue to fully heal. When you're talking about someone who has poor circulation, poor nutrition, it might never heal. They might, live with that pressure ulcer forever, and you can imagine how uncomfortable this would be, especially if somebody is incontinent now on top of this, because all that stool and urine is going to go right into that pressure ulcer, and it's going to cause a high risk for infection. I'm sure you can recognize why. This right here, this black area, is that eschar, that natural dressing that your body created. So I'm not going to touch that, right? And I can't stage that because I don't know how deep it goes. So I'm going to leave that there. One thing I want you guys to try to do, if you have an opportunity when you go to clinical, is to follow the wound care nurse. Every facility is a little bit different when a wound care nurse comes, but they usually come and make rounds on people who do have wounds, and they can address all different types of wounds, burns, pressure ulcers, venous stasis ulcers. There's so many different types of wounds. But if you have a chance, it's great for you to see these pressure ulcers so you can have an understanding of what it is. And so you can empathize with your residents a little bit, and hopefully it'll disturb you enough to the point where you will be very careful to never let this happen to someone that you're taking care of. So this is a picture of a skin tear, and you can kind of clearly see it just looks like the skin tore, like a piece of paper. And that's exactly what happened. This can happen with our older residents or somebody who has poor skin anyway from dehydration, or I find a lot of times people have been on steroids for a long time, or maybe chemotherapy that really affects their skin integrity, and it puts them at high risk for these skin tears. So this could just happen from moving the wrong way and your skin just tears. I've seen it where, we go to take a blood pressure, and that pressure from pumping up that blood pressure cuff rips the skin underneath. So if you know you have somebody that's high risk, be really careful with how you touch them. If you're pulling on them, they could just tear apart. So just be careful with these fragile, usually elderly people. This right here is, again, eschar on a heel. So I don't know how deep that is. I'm not touching it. So we talked about different stages. Make sure you know what they are. So this is a stage 1. If that does not blanch, then it is a stage 1. If it blanches, it's not a stage 1, but I need to be careful or it's going to turn into a stage 1. So we're going to keep a close eye on this and make sure that it doesn't break down any further. And then once you report this to the nurse, they are going to go and measure it. So that's a picture right there of a nurse measuring a wound. This is one of the first skills that you learn in nursing school, is how to assess wounds. So we are not assessing them now. The only thing you need to know is that it's there, and I need to tell somebody ASAP. This is a stage 2. So I've lost that first layer of skin. You've probably had a stage 2 at some point in your life, you know, from wearing those high heels that were so cute. Stage 3, starting to see some subcutaneous tissue, fat. Here's that stage 4 with the bone. All of these wounds, remember your skin is your first layer of defense against the environment around you. So when you lose that first layer, it's going to put you at high risk for infection. Make sure you know what infection looks like. You've all probably had an infected hangnail. You know lots of pain, swelling, drainage, redness, heat. Those are all signs of infection. Know it so that you'll know when you see infection. So, the policy is going to be a little bit different everywhere you go, but remember, no matter where you go, if somebody is on a turn schedule, it's going to be at least every 2 hours. So some places you might have something like this. It might be on the door. I know where I worked for a while, they had a sign that said like 12 o'clock ceiling, 2 o'clock door, 4 o'clock window. And it was a nice way for me as a supervisor to walk down the hall and see, is that person in the right position? Have they been turned? If it's 2 o'clock and they're still facing the ceiling, they didn't get turned yet and they need to be turned. So find out what that policy is wherever you go. And just know, you know, this is a huge responsibility. If you fail to turn someone and they end up with a pressure ulcer, you're going to end up being charged with negligence. You need to know different types of positions. So this is prone, flat on your abdomen with your head turned to the side. I like to sleep this way. Side lying positions. This one, the lateral position is kind of straight on your shoulder. We probably wouldn't position somebody in that position for a long period of time because that's not very comfortable. It's a lot of pressure on your shoulder, first of all. But you do need to know left lateral SIMS, S-I-M-S. That is a position that we would put somebody in if we need to do any kind of procedure rectally, like putting in a suppository or an enema. If you have a colonoscopy, you're going to be put in left lateral SIMS because it exposes the most amount of colon. So remember that term, left lateral SIMS, always on the left side. Lateral recline, this is more of what we teach you in class when you're positioning somebody. So you see you're not at a 90-degree angle, you're kind of at a 30 to 45-degree angle, and that's where we put that pillow right there. It's pretty comfortable if it's done correctly. Fowlers, so the person's going to be sitting 45 to 60 degrees, just the head is a little bit elevated. I don't really like this position, especially when you raise the legs like this. Some people like to do this because they're like, oh, then they don't slide down in bed. But look at all this pressure on that sacrum. It's basically your whole body is sitting on one point. And then we're surprised when people end up with pressure ulcers. This is not a great position to stay in for a long time. If I do have somebody in Fowlers, I generally don't like to raise their legs a whole lot because of that sacrum. I need to preserve that butt. Always remember to use good body mechanics for you and for the person that you're moving. Remember your principles: wide base of support, hold things close to the center of your body, use the strong legs and muscles in your legs, not your back. Practice that. I have seen so many people get hurt and have to leave the profession because they did not use good body mechanics. You only get one back. You only get one chance to get it right, so do it right every single time. Now don't come find you. So preventing that friction, that shearing, instead of pulling and tugging on people, we're rolling them, we're being careful, we're using equipment the way we should be, we're using turn sheets and slide boards, we're getting help when we need it. You know, we're not trying to be a vigilante superhero doing everything by ourselves. This is a team sport. We need each other. Use supplies as you need them. I don't want to hear, well, I couldn't find any pillows. Well, I'm sure you could find a blanket or a towel or something to prevent them from laying in one position for a long period of time. You have to get creative sometimes. We talked about footboards, bed cradles. Always move on the count of 3. Okay, so we're all on the same page, you and the resident. So they know what's going on, you know what's going on. Using a gait belt when we can so that we're not pulling on their skin, tugging on their clothing. That's the appropriate thing and the right thing to do. If you have somebody that is a Q2 hour turn and you put them in a wheelchair or a chair for the day, they still have to be moved. Nothing's changed because you've put them in the chair. If they can't move in bed, they also can't move in a chair. So I think that gets missed a lot. I'm not sure where people can't figure that out. But the way to do that would be to lift them up in the chair, move them from one side or the other in the chair, and that's still every 2 hours. Surprise, surprise, okay? So remember that picture I showed you with those 2 pressure ulcers right at the bottom of the butt? That's because somebody sat in one position for too long and wasn't moved. And that's going to happen. So we need to be moving them even if they're in the chair. If somebody can't move, you have to move them. So now you can never say no one ever told you. Okay? And if somebody's in their wheelchair, their feet should be on a footrest unless they are self-propelling and, they're moving themselves around in their wheelchair. Make sure they're always in good alignment. And you guys should know that term and know what it means. That means butt's all the way back, straight up. I don't want to see anybody slouched over in their wheelchair when I'm walking by. They should be sitting straight up. Okay? And shift their weight from at least every 2 hours. Okay, so then we went over pressure ulcers. Hopefully you have a better understanding of what they are and how to prevent them. And I encourage you to give that a try one day. Try just sitting in a position for as long as you can, see how much you can handle. Okay, so if you have any questions, please let me know. I'll see you later.